Hey everyone, this is Dr. Matt Sherwood with Sherwood Spine and Sport. This is the second video in our series pertaining to lower back pain and golf. And in this video, I'm going to be going over the most common swing characteristic that predisposes you to lower back pain, and that is called the reverse spine angle. So the reverse spine angle simply means that when we're in our backswing, if our target is over here, so I'm a right-handed golfer, if our target's over here, at the top of our backswing, our trunk is actually pointed toward the target. In actuality, if you look at professional golfers, their trunk is actually leaned away from the target. So there's a couple reasons that people will have this reverse spine angle. One, it could simply just be a coordination issue, or they just need to be taught. That's a simple fix. The other one is there could be anatomical or biomechanical things that prevent us from getting in the proper position. So for our backswing, if we're trying to get some rotation to go through the backswing, and let's say that the internal rotation of our right hip is limited, we're still going to want to get back. So a cheating mechanism would be we rotate, we block, and then it's just easier to flip and side bend and sway that pelvis over, and that'll tilt the shoulder toward the target and lead to that reverse spine angle. Another big one dealing with rotation is the amount of rotation in the thoracic spine. The thoracic spine is actually supposed to be pretty mobile, and in most people it's incredibly stiff for seated posture for a prolonged period of times, things of that sort. So in our backswing, if we don't get proper rotation in the thoracic spine, it's also easier just to side bend. And those are two common biomechanical issues that will lead to that reverse spine angle and predispose us to lower back pain. So in this video, I'm not gonna go over improving hip rotation. I actually did a video on that a little bit ago, and I believe it was entitled, "If you feel limited in your backswing or your follow through, try this exercise," and that will take you through that exercise to gain internal rotation of the hip. In this video, I'm gonna go through a very quick, effective way to increase our thoracic rotation. And then in the video subsequently, I'm gonna even combine that with a different hip exercise and a thoracic mobility exercise, so we can kill two birds with one stone in that video. So we'll go over that simple thoracic mobility exercise now. All right, everyone, so when we're doing this thoracic rotation mobility, you gotta be sitting for this. I suppose you could try it standing, but it's more moving parts and it's a little bit trickier to isolate the thoracic spine. So sitting is better. We want the knees and the feet touching together. And then we're gonna put the hands behind the head like so. And then when the elbows are kind of extended out, that locks the shoulder blades, and then it makes it harder to cheat. So we want to make sure we're eliminating any cheating, so we're just focusing on that rib cage and thoracic spine there. Before you do this, get an idea of your general rotation. So you've got to keep the feet and the knees together, which can be kind of challenging in and of itself. And then we're going to rotate to the right, and then you're going to rotate left, and just get a general idea of kind of where your elbow's pointing. I'm more restricted going to the right. And actually, ideally for a golfer, you would want about 45 degrees of rotation in the thoracic spine each direction. I am severely underneath that, so I need to be doing this more evidently. So what we do for the mobilization, so we'll rotate to the right, keeping feet and knees together. And then we're gonna gently side bend to the side you're turning toward. And when you're side bending, you wanna focus on side bending through that rib cage here. We're not lifting the butt off the chair, doing anything like that. No extracurricular activity, just through that rib cage there. So we'll take out the rotation, get our side bend, and then to get some more elongation, we're actually gonna use breathing. So it's imperative that when we're taking breaths in, we're expanding the ribs side to side and front to back as far as possible, so we get the most results from this here. So we're rotating, take our side bend out, big breath in, expand the ribs and exhale. On a nice long exhale, I'd like to make sure I'm relaxed even further and just kind of picture you're falling through that rib cage. Then I'm gonna do another big breath in, expand and breathe out. Fall a little bit more to that side. We're gonna maintain the rotation. We're gonna come back up straight, and then we take out more. And then you'll notice after, if you're doing it properly, when you take out the rotation the second time, you'll already have gained about 20 degrees of rotation. It works incredibly fast. The key is you just have to do it consistently on a daily basis. So we'll take out that next bit of rotation, side bend again, and then 2 more cycles of breathing. And then you come back up, and then you repeat the same process to the other side. Like I said, it works really quick. You'll notice a difference immediately, but you just have to be consistent with that. And that should help. You'll notice a big difference if you're doing that with your backswing and even the follow through. You'll feel like you're more free, you have more rotation through that spine, and you won't have to cheat and end up in that reverse spine angle.